Entrapment neuropathies are frequently seen in clinical practice but remain highly challenging to diagnose and manage. I'm very excited about this two-day course that I'm presenting together with Bridget Tampin and Colette Reithold for the MACP. Not only because it brings together three highly esteemed clinicians and researchers in the area of entrapment neuropathies and neuropathic pain, but also because it takes us all the way from basic sciences to clinics, incorporating the latest scientific advances in the field. In my part of the course, we will go through the pathophysiology associated with entrapment neuropathies and will discuss such phenomena as neuroimmune inflammation, demyelination, and axon degeneration. Importantly, I will make the neurophysiological knowledge directly relevant to clinical practice by explaining how these mechanisms may present in patients. We will address topical questions such as why your standard neurological examination of light touch, muscle strength and reflex testing is insufficient in the screening for neurological deficits. How can you test small nerve fibers in clinics? And what are potential pitfalls and opportunities of neurodynamic testing? A better understanding of the neurophysiology will certainly help you to better understand the distinct patient presentations, to accurately interpret your assessments, and it will also help you guide your management. So I'm very much looking forward to meeting you in the course.
Hello, I'm Bridget Tampin. In this course I will focus on the clinical examination of neuropathic pain. So I will present you clinical tools that we use to identify neuropathic pain, such as neurologic examination, bedside sensory testing, and we also will talk about neuropathic pain screening tools. We then will discuss what sort of criteria we can use to determine if someone actually has neuropathic pain or not, and also how to interpret the signs of heightened nerve mechanosensitivity, so positive or negative neurodynamic tests, how we interpret them in the context of neuropathic pain. We will use practical sessions and we will also use some case studies to demonstrate all of this. And I look forward to see you on the course. See you there.
Hello, my name's Colette Reithold and I'm one of the course tutors for the Entrapment Neuropathy course that's running at Worthing Hospital on the 30th of June to the 1st of July. I predominantly will be inputting into the management of patients with entrapment neuropathy part of the course. And there's three key elements to this part of the course. The first is to think about some of the physiological and biomechanical effects for these sorts of treatment techniques. Looking at the best available evidence. Then we'll also be looking at literature around the effectiveness of these techniques, looking at some of the trials and the systematic reviews that have been published fairly recently. And we'll also be very much focused on the practical application of these treatment techniques. So we'll be using case studies and you'll be given the opportunity to practice these techniques with some feedback and on how to progress and regress these treatment techniques. And I really look forward to seeing you there.